It is an automatic fail if you don't start every scale by either actually taking body substance isolation, i.e. putting on a pair of gloves, or just verbalizing it. And we don't have enough gloves for every person to use a pair every time they do a scale every day of every class. So we mostly will just verbalize it. But this takes the place of what is the real world where you actually simply put gloves on. One thing just to point out about the scale sheets here is that some patients have to be bold with an Those are the critical fail criteria, meaning if you don't do that step correctly, no matter how you do on the rest of the scale, you fail. Like, you have to do that step right in order to pass. Whereas other ones are like, you get points for it, and if you miss more points than 80%, you won't pass, but it's, it's okay to miss a couple of the other ones. So, BSI is a critical fail in every single skill sheet. Meaning you need to do the skill perfectly. If you don't start with BSI, then that's considered a fail. At the bottom, there's also a list of critical criteria. Everybody see that? So there's 4 on the oxygen. Did not take or verbalize BSI, did not assemble regulator without leaks, did not pre-fill reservoir, and did not adjust liter flow to appropriate rate. So most of these things correspond to a line that is bolded with an asterisk. So they're not double, like they're the same things, just written for you together at the bottom. So every skill sheet we go through will really try to emphasize what are the critical fails. So the first step, okay, BSI, so I'm going to verbalize I'm wearing gloves. My first step is to assemble the regulator onto the tank, ensuring the O-ring and proper alignment of the pins. So the O-ring is there's like a little black gasket right in there. Can you guys see right there below the pins? Kind of mushed a little black gasket right there. That needs to be present, and then I'm looking to see that the pins goes into the pins. Tighten it down. So now I have the regulator onto the tank. The next step is open the tank. I'll open the tank by turning 1 full turn counterclockwise and make sure that the gauge is facing away. If this were cracked, and as soon as I open the tank, it's actually putting pressure into the gauge. So if the window of the gauge were cracked, it would actually release the pressure through this. It would blow out. And so if you're looking at this, I wonder if it's working, and you turn it on, it will blow it out straight into your face. So the reason we always want you to face the gauge away from you and away from the patient and away from your crew is just if it were cracked and it were to blow, so that nobody gets hit by flying shrapnel. So here I'm a little bit scared because there's somebody in every direction. Yeah. If you had to, you could always just cover it with your hand or something. I mean, you might get glass in your hand, but at least you're not going to blow somebody's eyes out. Or facing it down towards the ground or something, just so that if that thing were to blow, it doesn't hit anybody. Okay, now I'm going to check. Confirm tank pressure. I will say the pressure of the tank is determined from reading the pressure gauge. As we determined 4, we're here at 800 psi, because those ticks go by 2s, I think. Oh no, they go by single 100. Okay, so I'm somewhere, I'm 850 psi. Okay, so now I've gone through all of my assembly of regular orange tanks. So the next step, I'm going to now apply a nasal cannula. This is a nasal cannula. See those 2 prongs that go into the patient's nostrils? Other end, obviously, goes onto the tank. Always make sure before you start putting this on your patient that there's not a knot in the tube. It's kind of annoying to have to take it back off the patient in order to undo the knot. So I'm going to attach it onto the tank. Adjust to proper flow rate. So now this is something that you simply have to memorize. The proper flow rate for nasal cannula is between 1 and 6 liters per minute. You will find patients who are on home oxygen who have a lower rate, who are on home oxygen at a rate of half a liter per minute, or even a quarter of a liter per minute. They'll be on 0.25 liters per minute. But we never do that in the ambulance setting because it's just not enough oxygen to make a difference. If we think somebody needs oxygen, we're going to turn it on higher than that because that's just such a minimum. That's like going from 21% oxygen in room air to 22% oxygen. It's not enough oxygen that it will help them. So realistically, we're usually doing 2 to 4, I would say. Most commonly 4 liters per minute nasal cannula. You're allowed to use some judgment. You can go down to 2, you can go as high as 6. Once you're higher than 6, this becomes uncomfortable because it's actually blowing high pressure air. It's very, very dry. Right into your nose. You can dry out your nasal passages. It's just unpleasant. So we never turn this up higher than 6. If somebody needs more than 6 liters a minute of oxygen, we're going to just use a non-rebreather instead. Okay? So for this class, you're not going to have real patients where you're sort of really making that determination. Just pick a number and say it. We don't want to hear 1 to 6. We want you to hear, there's nothing on the dial that says 1 to 6, right? The dial has numbers, so pick a number. 2, I'm going to put it at 2. Just pick something and go with it, okay? And in real life, you'll adjust that as necessary. So I'm going to pick 2. I'm going to turn this on to 2 liters per minute. So 1, 2. Okay, now oxygen is flowing. And you can't really feel it much at 2. If I turn it up to 4, you can kind of feel that there's oxygen coming out of there. Not a lot. I mean, 4 liters you want to feel. 4 liters per minute is not a very high flow rate, but it's something. You can tell that there's air coming out of there.
And how will you tell what the appropriate flow rate is?
It depends on, assessing your patient, signs and symptoms. If they start to get better, it's okay. If they don't, maybe you need to turn it up. I mean, it's really a lot of factors that go into that. So now, once I've got that turned on, I'm going to apply it to the patient. So the biggest thing here is to remember that when you stick this in their nose passages angle down. Think about it. The nasal passage is going to connect to the oropharynx, which is going to go back down to the lungs, so clearly this has to point down. So don't have this curvature going up towards the roof of their mouth, the roof of their nose. The curve has to go down towards the lungs. So the easiest way to do this is actually approaching from the front, so I'm going to come around to the front of the patient here. Take this. It's a little awkward, so this is why we have you practice this a bunch, because you have to kind of keep this taut for it to stay behind the ears. So the easiest way, I think, is to grab it like this. You can actually kind of control the angle that way. Come right up into the nose, right behind the patient's ears, hold it tight, and then just slide this thing down. So that looks really easy, but I tell you, some of you are going to come up and do this. So wait, that's not right. Okay, no, it's around like this, and then you do this, and then you got to do this one, and this comes out. Like, it's just, if you keep it tight and come from the front like this, it's going to just be much easier.
Just like that, right?
Just like that. Hold it tight, and then slide that out. And that's it. That's all you need to do. If you want to discontinue oxygen therapy, undo the lanyard and remove it. Okay? That's all there is to it. Take this off. So that's the end of nasal cannula.